Hello, everyone. Welcome. This is season two of Health Authority TV. I am Janan Sarwar, the deputy editor for Health Authority Books, an imprint in partnership between Indie Books International and Global Bookshelves International. Today, I'm here to have a guest who I've spoken to before on this podcast, but it's Dr. DeLon Canterbury. He's a PharmD, board certified geriatric pharmacist, CEO of GeriatRx, which is a consulting practice. I want him to share more about what he does. Just happy to have him here. Welcome. Thank you so much for being here.
Absolute pleasure, Janan. So good seeing you, and thank you for having me on.
Yeah.
Yes, I am so excited about advocating for our caregivers, particularly those dealing with older adults, and helping them navigate the maze of those medication lists. So, my job is to help families understand the risks and benefits of the current prescriptions, over the counters, and any supplements and vitamins they may be taking to make sure that they are not causing harm like falls or cognitive impairment or constipation, diarrhea, you name it. We don't want anything to affect our loved ones' quality of life. And oftentimes, medications are not thoroughly assessed on a timeline on when to stop. We're really good at starting things, but we don't really assess when is a good time to actually stop a medication. So there's this brewing, beautiful world of de-prescribing or the supervised removal of medications. And now there's more research burgeoning and growing in this space, looking at which medications are considered high risk and are beneficial to actually being tapered off.
That is just absolutely fascinating work, important work to talk about because, again, we know about prescribing, but de-prescribing practices to do the reduction of what you were saying, medication related harm, because a medication can fix one thing, but then cause another issue or complication just because of the different side effects. And you've spoken about this on different stages, recently had a TEDx talk as well. Tell us about that experience.
Oh man, that was just so exhilarating. Yes, we had a talk this past November released called The Power of Deprescribing, and it was so well received. Honestly, it was an opportunity to share more about my own grandmother's journey in medication safety and having to eventually be deprescribed where her dementia had spiraled totally out of control. And it was with the use of an inappropriate antipsychotic. And we eventually had a pharmacist who advocated for deprescribing, which we didn't know what it was about, but
Right.
she found that this medication was likely worsening her dementia symptoms and advocated with the provider and managed to come up with a tapering plan to remove Granny Mildred's med. And lo and behold, she got better after a few weeks and having the opportunity to share how this personal example can influence others to question a bit more intently about their loved ones' medicines and concerns, was really built to give people the toolkit on how to do so. Ask, and make sure you have the right list of accurate medications. Have a positive conversation with your provider and ask, when can I potentially stop one or two of these medications? And are they absolutely vital and important for me or my loved one to live? These questions can gauge positive conversations around deprescribing. And caregivers have all the power. So how do you position yourself and come prepared to talk about that is really the take-home message of this talk we gave.
So, when you think about the services that you provide and what you just described, it's that clearly you're supporting the geriatric population, an individual, but you're working with caregivers, or tell us more about the services and how, is it a caregiver that you work with? Is it the whole family system? Explain more about that.
Sure. So we are very much direct for hire or concierge service providers.
Hmm.
We work with businesses, we work with facilities, we work with the caregiver, and we also work with the entire family. And we
Okay.
generally end up working with the family. We become like the
Yeah.
family's advocate of, if you will. So in that process, we end up coordinating care between the patient, the caregiver, and the provider, or primary care physician. And so we may find opportunities to optimize the med list. We end up making outreach to the doctors on behalf of the family and coming up with a care plan together. So we really like to integrate seamlessly into the care team, but you're going to have access to us 24/7. So we're at a text or call away. And if there's any late night decisions you need to make, over the counter decisions and whatnot, you'll have access to our team of pharmacists to manage that for you.
That is really important. And, I heard primary care provider, but often these individuals are going to multiple doctors, right? Different specialists. So how does that work? How do you help coordinate that? Because that's also where a lot of the polypharmacy or different potentially duplicate
Mhm.
orders for a certain prescription can happen, right?
Totally. Yeah, that transition of care with different providers, different
Hmm.
pharmacies, different health systems all play a role in some of the risk factors we see in building those long medication lists. But the process is very much the same. It's reconciling the differences, it's prioritizing what matters most to the family and the patient, and leading with how some of the medications are contributing to any harm. We create a written action plan that highlights which meds are high risk or opportunities for de-prescribing. And then we share this action plan with the family and the care team based on our initial meeting, where we're prioritizing, again, using the aging-friendly 4Ms approach to care. What matters most? How are we preserving mobility? How are we preserving mindset? And lastly, how are we looking at the medications to make sure they're not conflicting with the past three? But that's been the bedrock of how we integrate and provide care coordination with the other specialists as well. As you can imagine, specialists are awesome. They know their stuff,
Yeah,
but they're often not trained in thinking holistically, especially from an aging-friendly perspective. They know their favorite drugs and they stick to it, but they're not
right.
seeing how, even if they are using guideline guided therapy,
Yeah,
that it may exclude real data for people 65 and up, and it may not apply. So what was cool in your 30s and 40s may not be as friendly to the body as we age. So we're bringing that expertise right to the table and using that as an impetus to advocate in a way that is completely personalized to our families.
absolutely. That's amazing. If you could have a magic wand or a possibility to redesign the healthcare system, what would you imagine that looking like?
There are several as our health system is in the US, deeper integration of social services and pharmacists, like having a team of social workers, nurses, and pharmacists who can maybe work remote and do care coordination on behalf of clinical nurses. If that was embedded more into the model, I feel that could really bridge some of those gaps when it comes to nutrition, education, some of those zip code disparities that we often see. I think COVID shed a huge light to the inequities we have in care. So having this kind of dream team of care coordinators of resources can be a huge lift so that we're improving outcomes and reducing admission rates. And of course, more importantly, making sure that each of the providers aren't missing anything in the care gaps because they're only, focused on that one snapshot of her person, instead of the entire model of parts of care. So I rather us have a dream team of pharmacists, social workers, and nurses, kind of instead of being, overburdened by their patient load, maybe we lessen that and use pharmacists really to the top of our license.
Absolutely. I think that it's fascinating just even realizing and thinking about what you're saying of, an average individual that does have a family member that is has a lot of medications, it can be overwhelming. Who doesn't have a pharmacy background or something like that. They might just say, okay, you know, my loved one is on so many medications, but to realize that you can advocate for them and there are ways to really help control and have this idealized version of a team, a true team that really has the best interests of the patient and the knowledge to still care for their conditions in just a more streamlined way. So I think that is a beautiful vision, and hopefully your advocacy, your speaking, the things you're doing can help raise awareness for that, for sure.
Oh yeah, most definitely. Most definitely. That's the goal.
Yeah, absolutely. What is coming up for you? Any upcoming events or things that you want to tell everyone about that you're doing, working on?
Sure, yes. Yeah, we've got a couple of trips lined up. The international conference on deprescribing
Hmm.
will be in late April
Great.
in Montreal. So I'll be a part of a panelist of non-traditional deprescribers, I guess, if you will, and
Yeah.
we'll be sharing more about our practice. If you're feeling like leaving the country and checking us out, you're welcome to come through. But for the year, we've got our hands in a number of pots, and I'd say our largest impact has been our deprescribing workshop initiatives. So we conduct essentially these educational workshops in faith-based communities, focusing on how people can have a safe space, one, about their journey in medicine and in navigating healthcare, but also equipping them on how to spot potentially harmful side effects, right? And letting them know what common side effects can occur as we age. So, education is the key to everything. So once people know where to start, they can start bringing what we learn from these workshops into their provider's office, and we could drive deep prescribing downstream. So that's been one of our new initiatives of our nonprofit we launched called the Geriatrics Foundation. So we're focusing on using our speaking repertoire to go
Yeah.
to church and use this as a model to bring deep prescribing in a community centric type of model.
Absolutely. That's a great model, great setting. Hopefully, you can capture a lot of people and continue what you're doing. That's really nice to know and hear. Thank you. Thanks for
Yeah,
sharing
appreciate it.
everything. If people want to connect with you, what's the best way?
Yes, go check out our website, geriatrics.org, GeriatrX as an x-ray.org. But we're all over social media, so you can definitely find us on LinkedIn, Facebook, Instagram, and YouTube. And you can reach out or look for DeLon Canterbury.
Yes. Thank you. Thank you so much for spending time with me today. Really appreciate you. And for everyone
Yeah.
listening, can't wait until next time. May you all be healthy, wealthy, and wise. Have a good day. Thank you.
All right. Thanks, Janan.